I am the state ombudsman, and I have been in this position for about a year and a half. For those of you not familiar with the Ombudsman program, it's a federally funded program that provides advocacy to residents in long-term care facilities. The program is free of charge, resident-driven, and serves to protect the rights of Idahoans living in long-term care facilities. Ombudsmen provide regular presence in facilities, investigate and help resolve resident concerns about their care, quality of life, and also empower them to self-advocate when possible. Ombudsmen promote the development of resident council to ensure residents have a voice in their home and to address issues of common concern. Ombudsmen also provide information, resources, and educational training to residents, facility staff, and the community related to issues affecting long-term care residents. In addition, Ombudsmen also provide information, resources, and training to residents, facility staff, and the community related to issues affecting residents in long-term care facilities. In Idaho, the program operates under the umbrella of the Idaho Commission on Aging. I am very excited about our presenter today. She's going to talk about a very important topic that affects a lot of seniors, whether in long-term care or in their home. And now I will hand it over to Sherry for some housekeeping information.
Thank you, Fanny. Good afternoon. I'm Sherry Young. My role is Family Counsel and Volunteer Coordinator for the State of Idaho Long-Term Care Ombudsman Program. I want to welcome everyone to our virtual Family Council meeting. We're excited to be able to bring these monthly meetings to Idaho. Before we begin, let's cover a little housekeeping. Please refrain from using your name or the name of your loved one. Do not name specific facilities. Please use the terms nursing home, assisted living, or personal care home to present to the group. If you need specific assistance, please use the chat feature to state the county that you are in, and we will have an ombudsman reach out to you. The calls have public access and are designed for family members as well as residents and friends of residents in long-term care. You have all been placed in mute upon entry. We will open the lines at the end so that all are able to ask questions or speak. If you would like to speak or do have a question, please use the raise hand feature. Once we've completed our presentation, we will open the meeting to questions. The chat feature is at the bottom of your screen as well. Once you maximize it, you will be able to ask questions to the chat moderator or others during the call. Please note, any concerns or complaints can be directed to the State Ombudsman Office. We will be hosting these meetings on the fourth Wednesday of every month. We host these meetings to empower and educate families and residents on all aspects of long-term care. Please note, these meetings will be recorded and uploaded to YouTube. Just Google Idaho Virtual Family Council and you can locate them. We will start with our presentation and then open up the meetings to questions. All of our monthly meetings use the same Zoom link and QR code, which makes it easy to find. Please join us on all of these monthly meetings. They will be great with a lot of important and meaningful information. Please let your circle of friends know so that they can join and participate also. Again, thank you so much for attending today's meeting. I will turn this over to today's speaker, Bridget Lubeck, Nutrition Specialist with the Idaho Commission on Aging, and let her introduce herself.
Hey everyone, thank you so much, Sherry. So let me share my screen. Can you see my screen, like the PowerPoint screen?
I can see it.
Yes.
Oh, thank you, Stephanie. Hi, Stephanie. Okay. Hey, my name is Birgit Lübeck. I work for the Idaho Commission on Aging since 13 years. I oversee the nutrition program that counts into home delivered meals, everything regarding congregate meals. And I also have a contract with the Idaho Food Bank to oversee the commodity supplemental food program. We're talking about the Older Americans Act as a federal law passed in 1965. The goal of the Older Americans Act is to help senior citizens live at home and remain a part of their community for as long as possible. The original legislation established authority for grants to states nationwide for community planning and social services, research and development projects, and personal training in the field of aging. Title III, that's how we call the nutrition program in the Older Americans Act, that is part of several titles. Title III provides federal funding for state units on aging, so that's us, and establishes the nutrition program. The nutrition program provides nutritional services such as congregate and home delivered meals, and is the largest program of the Older Americans Act. It created state, area agencies on aging, and local agencies. So on this slide, you can see the flow. As you can see, the Older Americans Act, as I just stated, created the nutrition program and also state unit on aging and area agencies on aging.
Birgit, we're still on the first slide if you,
Oh, I'm
Yeah.
sorry.
it's okay. Yeah.
Okay, so let me.
There.
Oh, is it better now? Can you see this now?
Yes.
I'm sorry about that. Okay.
Okay.
So again, so this is a funding flow for the nutrition, or in general for the Older Americans Act, and it goes to the Administration for Community Living. They're our federal partners. They give us a certain budget at a point in the year. It goes to the Idaho Commission on Aging, so to us. And for the nutrition program, it will go to the area agencies on aging, and from there it will go to meal providers. So everybody who is contracted, we have 95 meal providers statewide contracted with the AAAs. Each area agency on aging also contracts with a dietitian, and you can see on this slide our partners are in Coeur d'Alene, Lewiston, Meridian, Twin Falls, Pocatello, and Idaho Falls. So we have 6 area agencies on aging in the state of Idaho who oversee around 95 meal providers. The link, I will get to that at the end of the presentation, that I want to show you our website where you can find a lot of other information as well. One of the things that's really important is to create a wonderful environment. So if you think you want to go and visit a senior center, or your mom wants to go visit a senior center, that it looks welcoming, right? So it doesn't really matter where you go and socialize as long as you do it. It is a plus when the environment looks inviting, welcoming, and friendly. Customers that go every day in the community center should be encouraged through surveys to make suggestions to better the environment. Artwork could be displayed, plants that the customers need to take care of can be displayed. They can provide snacks and beverages so that customers can help themselves, offer classes that elders can choose to contribute to the community in meaningful ways. We have, for example, the fit and fall proof classes that are offered a lot in the entire state. Offer space to be able to exercise, offer hobbies, make sure your facility is organized, orderly, and clean. Keep the environment uncluttered and free from stuff to customers that they can move around without any issues. Maybe you all know someone who would like to donate their time to a community center once a month for an hour or more to teach how to paint or work with fabrics, enjoy a fit and fall proof class, or yoga. There are so many great people out there that donate their time as they are retired and enjoy company. This will also help everyone involved to fight social isolation as well. There are so many wonderful things that can be done by donating a little bit of time. Here you can see a couple of statistics how in 2014, we had 14.5%, 65 years and plus. And now the population is growing, as we all know. In 2060, we expect 23.5%. So there's a lot of research that needs to be done and how we can all help each other, and especially though how we can help the elderlies. And why we want to focus on nutrition, the Academy of Nutrition and Dietetics say that 70% of physical decline in older adults with chronic disease is associated with modifiable risk factors like nutrition, activity, and tobacco use. 90% of older adults have chronic diseases like diabetes, hypertension, and high cholesterol. So nutrition really is the key. These are some statistics I just ran this morning. So the Idaho Commission on Aging supported feeding these participants. It's very clear that the need to help will grow every year. So as you can see, we served between June last year, so we call it state fiscal year 2024, between June and July, 13,212 congregate participants, and also 479,000 congregate meals in those participants. And we served also 4,209 home delivered meal participants. That equals to 547,000 home delivered meals. So we helped serve over $1 million, over 1 million meals to congregate and home delivered meal participants. Our database is around 18,000 clients. So that's really a lot. And we are thankful that we get the federal funds and that the area agencies on aging, who we couldn't do the job without, make it possible to contract with the senior centers and help them as much as they can. Idaho's eligibility criteria. So the only eligibility criteria for a congregate meal participant is you have to be over 60 years old. And if you go to a senior center, so tell your loved ones, tell anybody you know, there is a congregate meal registration form to fill out with regular information. We don't ask for a social security number, but we ask, of course, for a birth date and a name. Of course, we would like to see an emergency contact, as in case something will happen, then we can contact that person. There are lots of activities depending on center, such again, fit and fall proof, bingo, crafting. There's a center I know they offer boxing, dancing, quilting. A lot of them have pool, billiard tables, cards, and board games. That's really a lot of fun to go. And for the home delivered meals, the eligibility criteria is a little bit differently. You have to be over 60, homebound, frail, and not being able to prepare your own food. That's general statewide. Because we have a wait list since October 2022 for home delivered meal participants that usually hopefully get quickly off the wait list due to a nutrition rate. We had to, or the area agencies on aging had to establish an extra priority list. So that's where the statement comes from below, where we talk about additional requirements may occur in each of the 6 regions. There are some more statistics for you. Age clients served. So for home delivered meals, we can see that most clients that were served were 85 plus years old, versus when you look at the congregate meals, most people that were served were between 75 and 79 years old. Also, I ran some statistics regarding gender. So we have 58% females that go to the senior center and get a congregate meal versus 39% males. When we look at the home delivered meals, it's almost 60% of females who benefit from the home delivered meal and 40% males. Looking at urban and rural in congregate meal participants. So most congregate meal participants visit a rural area versus home delivered meals may be most likely delivered in urban areas more. And that's a good reason. The good reason is because in rural areas, if you can still drive and visit your senior center, that's really awesome. Home delivered meal is harder to get the food to a home delivered meal participants if that person is really far out. There are sometimes challenges regarding, are there enough volunteers to help with the delivery? Is a senior center able to pay someone to deliver those meals? So there's a lot towards it that comes into play, but those are some of the reasons why. I go one back. I'm sorry. I also wanted to mention that 79% of the congregate meal participants are English speaking, 30.3, and 98% speak English from the home delivered meal participants. 36% are below poverty level, and 35.35% of the congregate meal participants live alone. And to slide 16, one of the things we always experience is food insecurity, unfortunately. It is an official term from the US Department of Agriculture. It is when people don't have enough to eat and don't know where the next meal will come from. It's a big problem in the United States, where 47 million people, including 14 million children, experience food insecurity annually. However, many more people, including millions who do not meet the definition of food insecure, turn to charitable food sector for support. Like, for example, the food bank that we come to in a little bit. Also, 30 to 40% of food production, is wasted. That 1 pound per person wastes food a day. A person wastes 1 pound per day on food, and 133 billion pounds of food are wasted and lost 161 billion in 2010. So it got better, but still the food waste has tripled in the last 50 years. So one of the things when we see people are food insecure on one side, on the other side, we have so much food waste. So that's something, we probably could all improve on, including myself, even though I try really not to waste any food. I always really think about all these people who have really nothing, and then you throw something away. And then we all know it can happen, hopefully not too often. So that's something that's very dear to my heart. We talk about food insecurity, coming back to this. So the causes of food insecurity, we have a lot of poverty and unemployment. So people who don't have a lot of money, can't afford to buy food regularly, may live in places where there aren't many stores that sell healthy food at a good price. I know, in fact, that some counties in Idaho, there's just one little grocery store and they ask really, really horrendous prices. On the other hand, they might not be able to survive otherwise, right? Even if you're careful with your money and savings, paying for a place to live can be so expensive that it can be hard to have enough left over to buy food. So that's when we talk about lack of affordable housing. And the third one is chronic health conditions. If someone has a long-term health issue, it can be harder for them to work and earn enough money. They may also have to spend a lot of money on medical bills. Effects of food insecurity. We all know you're food insecure, your physical health declines, your mental health declines, your well-being is not well-being anymore. It doesn't feel like it. And school and work might be really hard on you too if you get not the right nutrition. People who experience food insecurity are more likely to experience malnutrition and chronic conditions like heart disease and diabetes. Food insecurity can also hurt people's mental health and result in depression, anxiety, and stress. Not meeting basic needs like food and shelter can lead to social isolation, stigma and shame. Without enough food, people who experience food insecurity may have difficulty concentrating, have low energy, or miss school and work due to illness. That's very common, especially in children. We see a lot that are so depressed and have really hard time to go back to school, especially after the COVID. It's really hard. And then we have the programs like the Commodity Supplemented Food Program. That's a program, there are only two requirements. You have to be over 60 and you have to be below the 130% of the poverty guidelines. This program is run in Idaho since 2015. It is for elderlies, and how it works is that a food box, you have distribution agencies, around 65 distribution agencies the Idaho Food Bank is contracted with statewide, and an eligible participant goes and pick up the box. Or they can assign a proxy, like a friend or relative, and say, well, I'm homebound, I cannot get my box, but maybe my son or my daughter Jane Doe can go and pick it up. And they can. So they're, like I said, around 65 distribution agencies in Idaho. So all what you need to do is really, if somebody's in need, please call the Idaho Food Bank and tell them about the Commodity Supplemental Food Program box. And if they qualify, they can pick it up, or again, maybe a proxy can pick it up on a monthly base. That helps a lot with food insecurity. And some items in there are noodles, rice, cereal. The only item that needs to be refrigerated is the cheese. So, of course, having that said, we need to make sure that the participant has a refrigerator and probably has somebody, if they cannot do it by themselves, has somebody who can cook the food. But we talk about, in general, people over 60. This is not tied to being homebound. So if you have a stove, you can cook, because again, noodles, rice, you all need to be able to cook those items. Then you're good to go. It is a big program. This was just a small part, and I wanted to give you insight, and I want to leave enough time for questions and answers, because it is very different than the ombudsman program. Also, the regulations are a little bit different at a senior center than at a nursing facility. So I want to thank you for participating. But before I go, I want to also show you our website. And I want to see if I can we go there. And maybe somebody can tell me if you can see it.
Yeah, we can see it.
Okay,
Yeah.
thank you so much.
Oh, there it goes.
So,
Yeah.
thanks. So I always like to show this because there's so much information on our website too. There are a lot of, you go to home, we have 4 buckets, 5 buckets now with stay educated, stay connected, stay safe, stay at home, and stay healthy. Under stay educated, there are a lot of different classes you can take for free. They're just a couple minutes, maximum 5 minutes, regarding malnutrition, regarding dementia, regarding caregiving. So it's really great information. Of course, we have an event calendar down there. Under programs, you find all the programs we support. And stay at home, you find here the Commodity Supplemental Food Program, what I just talked about. So there's information. There's also contact information for the food bank. You can find, there's of course home delivered meals. So all resources, all our programs, excuse me, are on the website under Stay Healthy, congregate meals, and trainings, goals. Like I said, there's a lot of information to find, even senior centers. So if you live in a certain area, but you don't know how to reach an area agency on aging, you click on one, find nearby services. You click on one of the area agencies on aging, let's say area 2, and it shows you their website information, contact. So you can just call them and say, hey, I'm interested in congregate or home delivered meals. They can explain more to you depending what your need is. And again, if you would like to know more about the commodity supplemental food program, go to the program. There's a contact from the Idaho Food Bank down here, and you can apply there eventually for a food box or help one of your loved ones to help apply to help fight against food insecurity. And that was my presentation. Thank you so much for having me, Fanny and Sherry. And I turn it back over to you, Fanny.
Thank you. Thank you, Brigitte. Now we'll open it up to questions. I have a question, actually. Is there any data that shows if any seniors or older adults end up in long-term care facilities because of food insecurities or because they don't have access and they end up like in malnutrition or anything? Do you know?
Are you asking me, Fanny?
Yeah, yes.
I do regarding you talk about nursing facilities.
Yeah, either assisted living facilities or nursing facilities. Yeah, nursing
I
homes.
I really don't know. I really do not know. I'm sorry, I don't.
Okay. I was just curious.
But it's a great question. It would be interesting. It would be interesting who would provide that or who could provide that information. It's a
Yeah.
very great question.
Yeah. Okay. Any other questions? No? Okay. Sherry, do you have something or?
I don't believe I do.
Okay. All righty. Well, if there's no questions, we'll conclude our presentation today. And just want to thank everyone. Thank you, Brigitte. That's a lot of good information. Thank you for the presentation and for showing us the website as to where we can find more information. This was very informative. Thank you again for presenting today. And thank you to our guests for joining us today. Next month, we will be hearing from Adult Protective Services. So we hope that you can join us for that very informational presentation. So this concludes our presentation for today.
Thank you.
And
Thank you.
thank you again.
Thank you.
Thank you, Brigitte, for a great presentation.
Thank you so much for your time.
Bye.